In this video, a nurse will understand the various aspects of nail care, purposes, equipment required, steps of procedure, aftercare, and most importantly, what to do when things go wrong. In other words, common clinical error. Equipment required: clean gloves, underpad sheet, nail cutter. Enter the patient room. Perform hand hygiene. Introduce yourself to the patient.
Good morning, ma'am. Ma'am, my name is Meg. I'm assigned nurse from 8 a.m. to 2 p.m.
Check the patient's identification and explain the procedure to the patient.
Ma'am, may I know your name, please? Ma'am, for the confirmation, can I check with your ID band? Okay, ma'am, as you have been, you have done with surgery at 4 to 5 days back, I can see your nails are growing. So for your personal hygiene, I would recommend you to please trim it off. I'll trim it for you. Is that fine? Okay.
This is just a trailer, but if you are really interested in learning all clinical procedures, we have a video library that includes all clinical procedures followed at NABH JCI accredited hospitals. You know, all the videos are demonstrated by the clinical experts working at NABH JCI accredited multi-specialty hospitals. And the most important features of this video is that they include common clinical errors. Hey, so what are you waiting for? Contact us here and improve your clinical skills. Thank you.